Type 2 diabetes can lead to a number of other health problems, but there are ways to manage it. Dr. Eric Stanek, Chief Medical Officer of DoctorsNow, is here with more on today's Hello Health, and we are talking type 2 diabetes. I think a lot of us have heard of that. What is type 2 diabetes?
So diabetes at its core is characterized by impairment in metabolizing carbohydrates. So that's the case for both type 1 and type 2 diabetes, and by elevated blood sugar levels. Now, type 1 diabetes is a completely different process than type 2 diabetes. That's characterized by a lack of insulin-producing cells in the body that requires people to be on insulin lifelong. What we're talking about today is type 2 diabetes, and that's when somebody has functioning pancreas, functioning insulin levels, but it's characterized by insulin resistance, where the receptors in the body's periphery on skeletal muscle cells, liver cells, is not responding to the insulin that's being produced anymore, and it can cause elevated insulin levels and elevated blood sugar, which can lead to a plethora of issues down the line.
And is it something that can be controlled and handled?
Yeah, absolutely. It all starts with behavioral changes. So if you understand that it's a disease of carbohydrate metabolism, then the first thing to do is to reduce carbohydrates in the diet, particularly processed carbohydrates that are often loaded with extra sugar as a preservative. Going through exercise programs, making sure that you're strong so that your skeletal muscles are able to absorb that sugar is a good way to do it too. And then some people use medications as well to help keep those numbers under control.
Okay, you mentioned complications. What are some complications that can happen if this isn't controlled or handled?
So there's two categories of complications that come from long-standing uncontrolled type 2 diabetes. The first is what we call microvascular complications. This is small insults and damage to the small blood vessels in the body over time that can damage certain organs. So the first one to know about is kidney damage. We call that diabetic nephropathy. So small insults to the blood vessels that supply blood to the kidneys can cause damage to the kidneys and decrease somebody's filtration rate. If left uncontrolled for long enough, it can cause complete kidney failure that causes people to be on dialysis lifelong. The second is retinal damage. So everybody who has type 2 diabetes should have a retinal exam done by an ophthalmologist at least yearly. Again, if left untreated long enough, it can lead to blindness. It's one of the most common causes of blindness in the developed world is diabetic retinopathy. And then nerve damage or diabetic neuropathy. This is what we call a length-dependent neuropathy, meaning that it's the nerves that are furthest away from the spinal cord that get affected most, and that is your feet. So people who have diabetes should be looking at the bottom of their feet because a lot of times they can lose sensation down there. It can lead to ulcers, which can cause infection. If people didn't have diabetes and neuropathy, they'd be able to feel that because it would cause pain, but neuropathy causes an impairment in those pain receptors. Now, the second categorization for type 2 diabetes complications is what we call macrovascular, or damage to the large blood vessels of the body. Now, this isn't caused directly by elevated blood sugars, but by insulin resistance and elevated insulin levels in the body. And this is the part of diabetes that can increase your risk for a heart attack or a stroke. It increases plaque buildup in the arteries the same way that elevated blood sugar, elevated cholesterol can. And so this is the part of diabetes where behavioral modifications, dietary changes, and exercise plays a huge role, because a lot of medications can keep your blood sugar under control, but they don't necessarily fix the insulin resistance pattern. That's done by changing your lifestyle.
Okay, so it kind of has to work together.
Absolutely. It's always the behavioral changes that come first, right? Living healthy first and foremost, and then some of the secondary stuff down the line to optimize those numbers.
You can help people if they are, and first of all, they should probably come and get tested, right? We should all be screened for diabetes.
Yeah, if you're at the point where you're actually having symptoms from diabetes, like you're thirsty all the time, you're peeing all the time, you have an odor to your urine that smells kind of sweet, then things are already pretty bad. So that's why it's important for people to have a primary care doctor that they can come in and get tested. We screen for this just doing a basic blood sugar test for everybody. And then for people whose numbers aren't good, we do a test called a hemoglobin A1C that's commonly run in the doctor's office. It looks at your blood sugar over the previous 3 months, and we use those numbers to make the diagnosis.
And you have a special for your weight loss clinic, which might help with this as well.
Yeah, we have a few services at DoctorsNow that could help people that are struggling with diabetes or insulin resistance. The first is our medical weight loss program. We'll be going live in Altoona in a couple weeks. July 6th is the date for that, and we're offering a $50 off your first month for any medication plans effective through the end of July there. But we also offer other services for people who aren't necessarily trying to lose weight. Just regular primary care, we're in network with most commercial insurance plans, and we also have direct primary care, which is cash pay membership primary care. There's no surprise bills, copays, deductibles. All of your labs that we run in-house are covered under your membership fee. So it's awesome. People can learn more about it at the website, doctorsnow.com.
Well, thank you so much for sharing this, all the services, and helping us in today's Hello Health. We appreciate it.
Sure. Thanks for having me.
And you can learn more. Just go to doctorsnow.com or call 515-270-1000. You'll find locations in Altoona, Johnston, and West Des Moines, and you can check out their special at their West Des Moines and Altoona locations and see more on social